We are
Hello,
live.
we are live.
Good Gut Live, to be more specific. And it is a Good Gut Live all about the many types of SIBO. Now, we'll be answering your questions live, but we're going to be discussing and focusing mostly on the different types of SIBO.
We're technically, if we're being technical, because we're nerds like that, it's types of dysbiosis.
Right.
So we'll be chatting about those. We know SIBO's getting more popular, and
Yes.
now more people are knowing that they might have SIBO. More practitioners are talking about it. So we always want to come here on these Good Gut Lives and just empower you. And if you're not familiar with who we are, my name is Dahlia Marin. I am an integrative gut health dietitian, certified gut nutritionist, and one of the co-founders of Married to Health, which is an integrative practice of registered dietitians.
And I'm James Marin, integrated registered dietitian, environmental nutritionist, and the co-founder of Married to Health. And guys, that's why we started Married to Health, is we saw out there a lot of people talking about dysbiosis, which is great. We need that. And we need the books and we need the publications and we need more researchers, but we also need dietitians to be aware and to work with patients one-on-one, because it's one thing to be like, great, I now know about SIBO and the different types of SIBO. Now what do I do? How do you help me? And how do you individualize this? Because one of the things we see with SIBO or dysbiosis in general of the gut is it's an ecosystem. And just like you need a specific gardener for different ecosystems or a specific landscaper, you need that individualized approach for your specific dysbiosis and gut issues. So I love it.
And, we do know that we got started in SIBO because we are plant-based dietitians, and we
Yeah.
were seeing that out there. So many plant-based influencers, predominantly, this was several years ago, 5, 6 years ago, were saying, I had to stop being plant-based because I was diagnosed with SIBO. And we know that that's not necessary. So we're
Yes.
passionate about helping those who are 100% plant-based, predominantly plant-based, those
Yep.
wanting to eat and tolerate more plants who do have SIBO, IMO, SIFO, some type of dysbiosis of their small intestine.
Mhm.
And we do know IBS is now becoming more destigmatized, right? You have and even silly sayings like hot girls have IBS, and everybody's talking about IBS now. We do know that 12 to 15% of the American population, at least, has been diagnosed with irritable bowel syndrome, IBS. So they have had a change in pain, a change in bowel movements over the course of a few months, and their provider determined you have irritable bowel syndrome. It's not inflammatory bowel disease, it's not colitis, it's not anything else. Your bowels are irritable. So
Right.
we know, a pretty good chunk of the population has been diagnosed. We know there are probably a much larger percentage of people out there living with IBS symptoms who have not been diagnosed, because it's still, unfortunately, to this day, and it shouldn't be, a little bit taboo to talk about your poop and talk about your bowel movements and talk about your gas and your bloat. We hope you have a good relationship with your provider where you could bring it up so you can be diagnosed. But people still aren't seeking medical attention because they just think like, well, it doesn't matter. I'm just bloated. Who cares? But you could very well have IBS. And studies show that 14 to 70% of people who have been diagnosed with IBS do have some type of small intestinal or large intestinal imbalance, dysbiosis. So we want to break those types down for you today and really educate you all and answer any questions you have about the different types of dysbiosis, SIBO, IMO, SIFO.
And I want to say, you maybe be like, what's SIBO, IBS? I don't have any of this. So let me say, for those who are watching that have been constipated, or if you're regularly constipated, regularly bloated, regularly have diarrhea, or a combination of those, stomach pain,
Mhm.
fear of eating, constantly need to be next to a restroom, and maybe you don't realize what you have. So if these symptoms sound more familiar than the more medical terminology that we're using, this is what we're talking about, right? This is the epidemic we're seeing of gut issues, and it's very, very important to take action as early as possible and to understand how important it is. And shout out to Azteca Wellness MD, who bought a
Dr.
badge.
Ray. Dr. Ray's
Dr. Ray,
awesome. He's
what's
an
up,
awesome
man?
plant-based doctor. If you guys aren't following him, follow Dr. Ray. He's
Thank
amazing.
you.
Thank you for your support.
Love
Um,
it. We're seeing some.
and someone's asking a question, and this is a great question to get us started. Is SIBO IBS, or is it just SIBO? So,
Hmm.
you guys, all SIBO is IBS. Not all IBS is SIBO, because, like I
Hmm.
said, 14 to 70% of people who have diagnosed IBS have SIBO, studies have shown, but that's not 100% of them. So you can have irritable bowel syndrome for reasons outside of having small intestinal, bacterial, microbial, or fungal overgrowth.
Mhm.
So not every single person who has IBS will have SIBO, but a high percentage could. So it's always really important to get tested. Um, and work with a knowledgeable care team who can help you one order the right test. We
Mhm.
always recommend ordering a Trio Smart breath test. It is the only breath test on the market, and we're not affiliated in any way, shape, or form with Trio Smart. It's just the best test that's out there. But it's the only test that can test for hydrogen, methane, and hydrogen sulfide, SIBO, which are three of the four types of dysbiosis that one could have, or somebody who's knowledgeable and can help you rule out fungal overgrowth as well. So you might not have SIBO if you have IBS, but if you should be tested so you know if you do. And we want to dive into the different types so that way you all know if you have been told you have IBS or maybe you have SIBO. We want you all to know to ask, what type do I have? Because it's not sufficient for somebody to just say, well, your bowels are irritated, or I think you have SIBO. They should really be able to pinpoint and tell you what type you have.
Well, you went through the 3 types. You wanna
Mhm.
let's get it out of the bag.
So the four types of dysbiosis, not necessarily
Not
SIBO, but the
necessarily
four
SIBO.
types of microbial overgrowth one could have. The
Mhm.
first one is hydrogen SIBO. So there's an overproduction of hydrogen producing bacteria that have made their way into the small intestine. Commonly, this is E. coli or Klebsiella, and they are producing large amounts of hydrogen gas. So that would be
Mhm.
considered hydrogen SIBO that somebody could have.
Mhm.
There also could be hydrogen sulfide SIBO. They sound similar, but very different. Hydrogen SIBO is commonly associated with diarrhea. Hydrogen sulfide is associated with urgent and painful stool, not necessarily always diarrhea. But that could include other gut bugs like F. varium, Disolvivrio. Klebsiella can be a sulfur producer as well, Disolvivrio. So there's a different variety of hydrogen sulfide producing bacteria. You have methane IMO because it's not only in the small intestine, it could be an overproduction of methane gas from a type of gut bug called archaea, either in the small intestine or in the large intestine. So those are two areas where you could have overproduction of this type of methane gas. Methane IMO is commonly associated with bloat and constipation. So if you're super bloated, super constipated, you've been diagnosed with IBS, you want to make sure they ruled out methane IMO for you. And the last type is SIFO, small intestinal fungal overgrowth, or it could be just fungal overgrowth in your small intestine or your large intestine. This one is not as commonly supported because we just don't have a lot of information about it. There are some really amazing gastroenterologists and researchers who are researching more on SIFO. Satish Rao is amazing in this aspect and in this field. He's, very highly respected gastroenterologist who speaks a lot about fungal overgrowth, but that absolutely can be another form of dysbiosis that one could have. And with that fungal overgrowth, symptoms could commonly be constipation, extreme bloat, and then just yeast symptoms. So, white coating on the tongue, like oral thrush, a lot of dryness and itchiness because yeast are very drying. So, dandruff could be a symptom, dry, flaky skin in the ears, dry, flaky vaginal skin or vaginal itching, or itching in moist places like nasal itching, ear itching, itching on the scalp where it's oily as well. So you want to really make sure your care team is helping you assess, do you have any of those four types of dysbiosis?
Very cool, guys. So that's it. Okay, bye. No, there's more. So we want to answer your questions on that. We want to just kind of keep reiterating and dive deeper into that and just understand we are very unique in a sense, of course, to pat ourselves on the back. Oh my gosh, we're so unique. No, I'm just kidding. But we're unique in a sense that we have, or I should say, Dahlia really has devised a program that is 100% plant based. Because one, typically when you have a type of this dysbiosis, specifically when someone's using the word SIBO, they're going, okay, eat more chicken, eat more fish, avoid FODMAPs. That's an acronym we can get into in more depth, which is essentially avoid plants and fibers, evil, and grains are evil, and beans and all legumes are evil. Avoid all of that. And so you start to go the route, and that's why we've seen over the last, especially 5 years, a rise in paleo and carnivore, and the
Mhm.
list goes on and
To
on,
starve it out.
to starve it out, right? But what happens is you starve it out and you continue to starve other microbes and you
Mhm.
go down. It's literally like digging yourself a hole. And for those of you that have been following us, we do liken it to debt. It's like you've been avoiding debt, avoiding debt, avoiding debt. You change your number, you change your email, you change your address, you move to avoid the debt collectors. And then when you go to finance a car or buy a home, or one of your kids needs you to co-sign for them, your credit is completely shot, right? We are saying, and our approach, and this is number two where we're different, is that we say face this head on. You have dysbiosis for a number of reasons, which we've gone into in past lives of why there's SIBO and our approach. But you have the SIBO or the dysbiosis. Now face it head on. What we're saying is plants are actually the solution. If you're having issues with eating plant foods, then you need to face that head on. We need to identify that. Just like if you're having an issue with debt, it's not to say run away from it. It's how do I better manage my money? It's not saying I want to run away and never use money again as well. You need to eat food. In this sense, we're likening money to food. You need it to survive, but there's a better way to budget. There's a better way to use it. It can even start working for you, which is what we want the food and your gut microbiome to do, it's literally there to support and love you and keep you healthy and thriving, right?
Mhm.
So very, very important. And then also number three is that you need a customized and really hands-on approach, because there's many practitioners out there that go, yeah, I'll help you with dysbiosis and SIBO. Here's my protocol. And patient one gets the protocol, patient two and three and four, they
It's
get
the
the
same
same.
diet, same supplements, same medication, same everything. And those 3, 4, 5, 6, 7 patients, they could have 4 different types of dysbiosis. So you always
Right,
want to be weary of anybody who's just giving you kind of a blanket for one issue when we're saying SIBO is not all the same. You could have different types of dysbiosis.
right.
And we have a good
Yeah, I think this
question.
goes into that question well.
Someone saying, "Why is the SIBO Center in NYC?" I don't know this place, so
Yeah.
no disparagement to them. But diagnosing me with IBS if I test positive for SIBO, it
Mhm.
makes me angry that they don't call it what it is. I don't know. That's interesting.
Very
My
interesting.
guess would be maybe it wasn't a physician who interpreted your results. Really, only a MD, a DO, a nurse practitioner, or a physician's assistant can make a diagnosis. So, for example, if a dietitian breath tested you, they can't legally tell you you have SIBO because it's not in our scope of practice to make diagnoses. So, and maybe you didn't see an MD, but if you did and they're just telling you you have IBS and not SIBO, even though you tested positive for SIBO, there is a little bit of a lag we've seen. Really, it's just been in the last 5 to 10 years that a lot of SIBO research has come out. Although Cedar Sinai and Dr. Mark Pimentel, who's one of the lead SIBO researchers in the country and one of the top in the world, has been researching SIBO and dysbiosis for over 20 years. It's really just been in the last 5 to 10 years that we have guidelines from the American College of Gastroenterology. More gastroenterologists are even willing to admit that SIBO is a diagnosis. So sometimes there's a lag time from physicians who are adopting the latest and greatest from the research. And a
Mhm.
lot also will wait until it's a solidified guideline. And we know it takes 12 to 15 years for something to even make its way into the guidelines. So there could be amazing, robust research out there for 12 to 15 years, but until the organization makes their guidelines, some practitioners are hesitant to admit that it's a thing. They don't want to risk liability, or they're hesitant to adopt anything that they aren't sure about. So that could be why maybe if it was a licensed provider like that and they don't want to say that it's SIBO, maybe they're just a little bit behind. But I would assume that some place calling themselves a SIBO center would be up to date on what it is. So
Yeah, that's
I can't
interesting.
definitively answer that question for you.
Another
um, So
This is Hi Dahlia, loved our consult last week.
thank
Quick
you.
question: do you guys have any protocol for Crohn's
Mm,
and Crohn's disease, falling the umbrella of IBD, inflammatory bowel disease? Where there's, I know a lot of people get those confused: IBS, IBD, IBS, irritable bowel syndrome, IBD, inflammatory bowel
mhm.
disease. And the big difference is one is autoimmune and the other isn't. So IBD is the autoimmune, like Crohn's disease or ulcerative colitis, where your immune system is attacking parts of your intestine and colon.
Or
So,
small
or
intestine.
small intestine as well. So, um,
We do have a protocol for IBD in our practice. So yeah, that is always something that we can chat about.
yes.
And someone's asking, how do you find out if you have overgrowth in your small intestine?
Mm,
Would a capsule camera catch that? So the best way to test for that is actually a breath test. I would say the Trio Smart breath test is very highly sensitive and specific. And gold standard would be during an endoscopy if they can perform a small bowel aspirate and take a sample of the fluid from your small intestine. They could culture for the gut bugs that produce hydrogen gas or methane gas, but they really can't culture for um, hydrogen sulfide producers yet. And they can culture for fungal overgrowth or yeast overgrowth. Just a lot of facilities aren't equipped to do that. Or, like I said, a lot of providers who perform endoscopies are not on board with saying that fungal overgrowth is a real diagnosis. So it just really depends on who you're seeing. But I would always ask your provider for a Trio Smart breath test. So, you always want to figure out what's going on. And somebody's saying they have 3 out of 4 types of dysbiosis. Aren't I lucky? So
oh,
you might need several iterations of different ways of eating, which we'll dive into right now, and several different ways of treating, which I think is a great point.
mhm,
You definitely need to personalize your nutrition and personalize your protocol based on the type of dysbiosis you have. Low FODMAP is very commonly prescribed, and it's probably the most commonly used diet for IBS or for SIBO because it's very well studied. Monash
mhm,
University created the low FODMAP diet, and they continue to update every single year. They continue to update the portion sizes and which foods are more fermentable. And if you're not familiar with low FODMAP, it stands for low fermentable, basically types of carbohydrates: oligosaccharides, disaccharides, monosaccharides, and polyols, which are all types of starches, sugars, and fibers in carbohydrates. So
mhm,
when we are having less fermentable carbohydrates, in some cases, 50 to 80% of people with IBS or with certain types of SIBO will respond to low FODMAP. But again, what about the other 20 to 50%? What do they do? So if you are somebody who has hydrogen SIBO, if you have methane IMO, those can be 2 cases in which low FODMAP can be helpful.
mhm,
So I often will recommend a low FODMAP way of eating, an elimination diet for no more than 4 to 6 weeks, and then slowly start to reintroduce them. Hopefully, in those 4 to 6 weeks, you got answers of what's going on. You started treatment and you're eradicating the overgrowth. And then 4 to 6 weeks after you have treated what's going on, then you want to start your elimination period. And then, depending on what you have going on, if you have methane IMO, you want to make sure you get on a prokinetic, a pro motility agent to help with gut movement as soon as you possibly can. Right when you are diagnosed, you really want to start a pro motility agent, take a pro motility agent with your treatment, and stay on a pro motility agent after you get off, because that will help prevent relapse. So if you're decreasing the fermentability of the carbohydrates, again, you're not really feeding those gut bugs. So in after you have treated them and taken antibiotics or taken antimicrobials, whatever you and your care team decided, then you also want to make sure for those 4 to 6 weeks following that protocol, you're not feeding them. You're going low FODMAP. Um,
and this is not medical advice. These are general
mhm.
recommendations just off the years and years and years of Dahlia's experience and our experience as a
And the
practice
guidelines.
and the guidelines.
Hmm.
But again, you're an individual, you're unique, so you need that individualized approach. So take that into
Hmm.
consideration.
And we will be saving this video. Somebody's asking, they're saying they have to go to
Yes.
work. But yes, this will be saved on our YouTube and our Facebook and
And
here
on
on
Instagram.
Instagram.
Yeah.
So, like I said, for somebody who has hydrogen SIBO, They might be having diarrhea. And so having less fermentable carbohydrate might help decrease the amount of diarrhea that they have because they're not making as much hydrogen gas and that's not causing as much diarrhea. For somebody with methane IMO who has constipation, having less of that fermentable carbohydrate can reduce the amount of constipation that they have. And so what we do know then is maybe you don't have hydrogen SIBO, methane IMO, or maybe low FODMAP didn't work for you. So you want to try to go with a different approach. For somebody with hydrogen sulfide SIBO, you should be eating lower sulfur because we do know sulfur is going to feed those sulfur reducing microbes and those sulfur reducing bacteria. So if we want to decrease again how much we're feeding them as after we're treating them, you want to really pull back from high sulfur foods. So maybe you're pulling back from cruciferous vegetables or some of those allium vegetables like onions and garlic, even some supplements. And I see this happen with SIBO treatment. I had a patient, I have to share this with you guys, and she saw an endocrinologist who diagnosed her with SIBO through a stool test. So, red flags there. One, endocrinologist, not the proper provider to be diagnosing somebody with SIBO. Two, you should never be diagnosed with SIBO through a stool test. And three, this patient has all the symptoms of hydrogen sulfide SIBO, and she was given all these sulfur containing supplements. She was given berberine, she was given neem, and she was given garlic. And she was like, I feel so much worse. And I was like, well, yeah, you're feeding them. You're not supposed to be taking any sulfury types of bacteria. So, of course, that patient was frustrated because she spent almost $500 on a stool test. She spent hundreds of dollars on these supplements. And again, because she wasn't working with a knowledgeable practitioner, none of that was valuable for her.
Thank you for watching this. We hope you know by now Married to Health really does everything we do coming from a need in our community, a need from our patients, a need from being dietitians for over a decade, from running our own private practice. And we continued that when we formulated Gut Nurture. So if you didn't know, Dahlia Marin, RDN, LD, CGN formulated Gut Nurture along with Complement. We truly believe it is a great complement for your gut health journey. Why is that? Well, it's low histamine, it's low FODMAP, it's organic, even the package is compostable. We really designed it with a patient in mind that is wanting to eat more plants, that needs to eat more plants, but is struggling to eat more plants. This is that bridge. We also designed it for the person who's just like, I want to boost my gut, I want to feel really good, I want to help with the structure, function, and population of the gut. This is unlike anything that's really out there in that as it's focused on being a prebiotic, not really a probiotic. So the idea here, you can think of Gut Nurture as compost for your gut ecosystem. It's not trying to force seeds and the probiotics in, it's trying to create a beautiful environment and a beautiful foundation. So any seeds you get from the fermented foods you're eating, from your environment, from the beautiful habits you're building, whether you're working with us or not, they are going to fall on this beautiful, healthy soil with this beautiful, healthy compost and create a lush, beautiful ecosystem and garden, creating an abundance of fruit and postbiotics that are going to keep you healthy and thriving. So click down below, learn more about Gut Nurture, and we'll continue with the episode.
So we got her eating lower sulfur, we got her on the right protocol, and she started feeling much better. And we hooked her up with a gastroenterologist. So it goes to show the way that you eat can really matter for your dysbiosis type. So we talked about how to eat and what to do for things like hydrogen, methane, hydrogen sulfide. And then, for SIFO, if you have fungal overgrowth, it's going to depend. I do know a lot of practitioners, especially, and I'm not hating on them, right? I've been trained in functional nutrition. I used to work with naturopaths. A lot of them will recommend a candida diet. And basically, they'll tell people not to have any type of starch in their diet. Don't eat fruit outside of berries. Don't eat any grains. Don't eat beans. Really don't eat carbohydrates because we're going to starve the yeast overgrowth. And what you do see happen with that is one, usually in fungal overgrowth, it happens because they're opportunistic and there's lack of growth of healthy microbes. So what we do see is if there's not enough acid producing bacteria, not enough lactic acid, lactobacillus, bifidobacteria, these opportunists like the yeast and like the sulfur reducers are going to overgrow. So when you're starving out the yeast, you're also starving out those good guys. So you're just going to be in a perpetual state of dysbiosis. I really don't love these starvation diets, whether it is a candida diet or whether it is something like the elemental diet. I really only use that as a last resort. But I don't recommend these starvation diets. So, for the most part, what we use in our practice is a lot of times a low histamine way of eating for those with yeast overgrowth. We know that yeast make histamines. And so, on top of the histamine someone is already encountering just externally from the environment, whatever they're making from their own hormones, like we know females usually make more histamine because estrogen releases histamine, or if somebody's very stressed and they're releasing a lot of adrenaline, they're going to release more histamine. If they have yeast on top of that, yeast will release histamine. So, what we like to do is recommend a low histamine way of eating. And we recognize, like someone's commenting, they have 3 out of 4 types of dysbiosis. We do sometimes combine these ways of eating. So sometimes for
Mhm.
4 to 6 weeks, we'll have somebody on a low sulfur, low histamine, and then we'll give them the right tools that they need to break down sulfur and break down histamine and try to balance out their dysbiosis so that way they can start reintroducing them and definitely start eating them again after that. But again, if your provider is unfamiliar with the different types of nutrition that can be valuable, they don't refer you to a knowledgeable GI dietitian. That can be very difficult for you, and you could be left suffering a lot longer than you should.
So a lot of great info. Thank you, DSAMS. Bought a badge. Thank you so much, guys. We appreciate the love that you're showing. Another comment, I think this was from a past comment about the naturopath, and they're saying, all my doctors gaslight me. I wish Pimentel was my doctor.
Mm.
I bet, yeah, he has a good fan base, Pimentel, for sure. You want me to answer that one or say that one?
Yeah.
Are you familiar with biphasic diet?
Mhm.
Yes.
Yeah, so we're familiar with the biphasic diet. It's an interesting concept where it's kind of low FODMAP and then increasing the FODMAP slowly in the second phase of the diet. And it can be really helpful. We use a slightly similar approach in our practice, but we've kind of broken it down into a 7 phase rather than just 2 phases. That way, people have more of a chance to understand what their triggers are and just gain more insight into their microbiome type and what foods work for them and which foods don't. But that is something that I have had a lot of patients try in the past.
And this is really a culmination of just many, many years and many, many patients where we realize, yeah, biphasic, right? 2 phase diet, we developed 7 phase because there's so much nuance. You guys, again, we're all humans. I always say a quick analogy, which is like we all look like fingers from far away. Oh, it's the same finger. But as we get closer and you really take time and understanding, you start to understand that we are all unique, just like a fingerprint, right? We look the same, but as we get closer, we're all different, and a lot of times very different. So this
Mhm.
is where more phases that aren't just there to be like, oh, we're just going to add more phases and do it up that way. No, they're there for a reason. They're there for a purpose, and they're based off feedback from our patients
And study.
and studies. So definitely using an evidence-based approach and an integrative approach, meaning a root cause approach. We're not here to just put you on either supplements or antibiotics and a quick elimination diet and go, okay, great, you're all better. And then in 3 months, we hear the patient comes back and like, no, it's all back again. Okay, we'll do the same thing and just keeping you on this yo-yo over and over again. So it is kind of crazy what's out there in terms of these
Mhm.
protocols that just keep people coming back and back and back. So yes. Okay. I have a couple of questions here.
Yeah.
What are you looking at?
Let's answer this one here.
Okay. Hi. Is there a certain age where a person is more prone to get SIBO, or can any age group get SIBO? Again, SIBO meaning small intestinal bacterial overgrowth. But basically, it's dysbiosis. It's an imbalance of your gut microbes. So,
Mhm.
what do you think?
I've
What
seen
is
patients of all ages. I would say my youngest SIBO patient has been 5 years old, and I've had 90-year-olds have SIBO. So there's not necessarily a specific age, but I think it's just risk factors. We
Mhm.
do know that risk factors for IBS are high use of antibiotics at a young age. Being female is going to increase your risk for IBS. And we do know high stress lifestyles can be risk factors as well. So,
That's none of you.
yeah.
None of you are like that, right? Give a heart if that's not you. No, I'm just kidding. Um,
So if that's the case, right? I would say I've seen kids of,
yeah.
again, young ages with SIBO if they've had high history of antibiotic use. Basically, anything that is affecting the balance in your gut for a prolonged period of time, anything that affects your motility, the movement in your gut for a prolonged period of time, and anything that affects the structure in your gut for a prolonged period of time, that's going to increase your risk for SIBO or for dysbiosis.
Right.
So that could come at any age, any stage. And it doesn't always happen right away, right? We don't always, I have patients who are like, yeah, I had a low fiber diet. I was chronically constipated as a kid. I took tons of antibiotics. I had a very chaotic, stressful childhood. Maybe they didn't have SIBO symptoms until they were well into their late 20s, 30s, 40s.
Mm.
So sometimes it catches up later. No specific age, but I think that's a great question. I wouldn't rule it out for any age or stage. And if a child does have SIBO, you always want to figure out why. I have a 9-year-old who I'm working with right now, and her mom said she has only taken antibiotics a handful of times in her 9 years. She's had regular bowel movements, but she's just always bloated and distended. So we were able to get her a SIBO test, and we were trying to figure out the root cause. And her mom was telling me that we noticed that her liver enzymes were very high. And I asked her, ask your daughter what color her bowel movements are. And she said a lot of times they're tan or they're gray. So, with her
Mm.
pediatrician and her pediatric gastroenterologist, we got her liver checked. And sure enough, she has advanced stage non alcoholic fatty liver disease. And that is likely the root of her SIBO because bile is an important digestive juice, and that comes from the liver. So if your liver is struggling, maybe you know that you've had fatty liver in the past. The liver is not making that digestive juice that helps break down fats, that helps to activate a hormone in the small intestine called motilin, that helps to act as an antimicrobial. So for this child, her care team and I are thinking possibly this fatty liver that has likely been there for several years is the culprit behind her SIBO. So that affected her motility. So it's
Yeah.
always super important to work with somebody who can help you figure out what you have and why you have it. Because if not, it will just keep coming back over and over. This child has been treated for SIBO before. She was treated 3 years ago. I think she never was clear of it because her mom just said she's been more and more and more distended over those years. So they didn't really figure out why. They didn't support the root. Her liver never got great support. And so here she is several years later, still with SIBO.
Wow. Okay. We'll go through a couple more questions. Is artichoke root enough for prokinetic?
Mm. It can be helpful. It depends on the person and the level of support that they need as far as prokinetic and promotility agents go. So, artichoke and ginger could be helpful. Sometimes we'll use something like 5-HTP, which is a precursor to serotonin, since serotonin really induces motility in the small intestine. Sometimes somebody needs something more prescription strength. So, they'll be put on something like Motegrity, or they'll be put on something like Linzess or another type of pharmaceutical prokinetic or promotility agent. So it really just depends on how much motility support you need. You could always consider other things like combining with magnesium or combining with a type of fiber powder. And sometimes it is just the nice mix of different things that really help someone have regular bowel movements. But I will say, especially if you have a constipated type of dysbiosis, like you have fungal overgrowth or methane overgrowth, you absolutely need a promotility agent, a prokinetic during treatment and post treatment if you don't want relapse and you want total clearance.
Here's a good question.
Thanks, Adam.
Yeah.
We love
What's
the
up,
love.
Adam? Gave you a little
If you guys
ways.
don't follow Plant Based Addict, Adam is amazing. He is he's a coach.
It's a lot
He's
of things.
extremely inspirational. Yes, he's amazing.
Researcher.
He's in recovery. He's been in recovery for well over a decade. But yeah, Adam's amazing. So thanks for the love. We appreciate it, Adam.
This was a good. I thought What is the typical timeline for
Mm,
SIBO recovery? We get that question a lot.
yeah.
And I mean, overall, it's hard. I mean, we give the general answer of like everyone's unique, like we've been saying, right? But I think on average, what would you say on average if you had to give an average? Because you really,
I would say minimum, if somebody is barely SIBO positive, maybe you have a a slightly positive SIBO test, right? And, we'll break it down. If you are positive for hydrogen SIBO, that means that you are producing over 20 parts per million of hydrogen from where you're starting in the test. So hopefully you're starting close to zero. But if you started at 5, if you're over 25 and you tested with lactulose, you're positive for hydrogen SIBO. If you tested with glucose, it's over 12 parts per million. So 12 parts per million above where you started. You're positive for hydrogen. If you have methane SIBO, it's because you were above 10 parts per million for methane gas in your breath. And with hydrogen sulfide, they actually just updated it. Was 5 at first, then it went down to 3, and now they're saying anything above 2 with symptoms is considered positive for hydrogen sulfide SIBO. So if you were barely positive, maybe you were 5 points above where you should be, or 3 points above where you should be, and you get the proper diagnosis and treatment, you could very well recover within 3 to 6 months. That's very reasonable, sometimes shorter, sometimes a little bit longer. However, say you're that patient, and I have had patients who are 5 to 10 times higher than where they should be with these levels of gases. I sometimes have people test and their levels are over 100 or 200 parts per million of these gases in their breath. That person is going to be in treatment for a lot longer. They probably need several more rounds of antibiotics, antimicrobials. They might need to prolong how long they're on an elimination protocol. So, that very much varies. It's no one size fits all, but I would say get tested so that way you know how much SIBO you have, and that can give you an idea of how long you'll probably be in treatment.
this next question is great. So, after 7 phases, do you believe in getting back to eating everything again, or do I stay on a specific diet going forward? I would
Mm.
say this is where you've all heard of an elimination diet. And maybe, and for those that haven't, you're eliminating foods as you go on the diet. So the progression is you eliminate, eliminate, eliminate. We are coining the reverse elimination diet. So the umbrella term for these 7 phases, again, there's a lot of details and nuances that we help guide our patients through. But overall, it is reverse elimination. The goal is to eat a diversity. The goal is to eat an abundance. There are 800,000 plant species in the world, of which about
That's a lot.
40,000 are edible. That is way more than the typical animal products that especially Americans are eating. You're eating maybe about 2 to 3 different animal products a week if you're a typical American. And so with that, you have 30 plus thousand different plant foods, up to 40,000 plant foods that you can eat. So we want you to have that diversity of crunchy and soft and cooked and raw and fermented and pickled and all of the above. So yeah, the goal is to get you there. The goal, especially for many who have like, I haven't eaten raw food or
Mm.
this certain food raw or this certain food fermented, or I've never eat fermented foods. We want to get you there and get you back to an abundance of eating, an abundance of diversity. That is the goal.
Or to help you really identify the handful of foods you need help digesting. For
Yes.
example, a lot of my patients who go low FODMAP go through the reintroduction, and we're very systematic about how we do reintroduction, because if you just bring them all back in and you feel bad, you're not going to know which one caused you to feel bad. So you should
Mhm.
be reintroducing group by group, food by food. And at the end of the day, if you recognize I react to polyols, I react to fructose, I react to fructans, then we can help you digest those a little bit better and figure out why you're still not tolerant of them. So maybe you still have damage that we need to work on in your small intestine. That's where you're making 60
Mhm.
plus percent of your digestive enzymes. So if your small intestine has damage and you're still not making those enzymes, you're still likely to feel uncomfortable, in pain, and bloated when you're eating those foods. Maybe you need help from a digestive enzyme and some leaky gut support. And then you're feeling better and you can now tolerate fructans. Or maybe if you're still having sulfury gas and you're still having some of that go on, maybe you need the right probiotic again to bring some of those lactic acid bacteria back into your gut to keep those sulfur reducers under control. So it's always the goal to try to get to your root cause and help you eat the largest amount of variety as possible, because that really is how you heal a gut. You are never going to heal a gut by starving a gut. You always, always, always want to try to add back.
And it's very logical when you think about it, right? Everyone, it's very logical. Like when you look at an ecosystem, does the ecosystem thrive when it has very little? Like, let's just have one type of tree and one type of animal in the ecosystem, and it's going to thrive. Rarely does that happen. An ecosystem thrives when you have diversity. You're talking, think of jungles and forests. Think of when you go in the ocean and go snorkeling. Do you want to see all kinds of coral reef and fish and sharks and turtles? Or one type, right? So that is your inner ecosystem. That is your gut microbiome. It is teeming with life. However, due to our lifestyles, especially in first world countries, we are losing that diversity in our gut. We are here to bring that back. That is the goal.
Do you discover root cause to determine which way you treat the SIBO? We always try to.
These are great questions.
Yeah, these are great questions.
Um,
We always, always, always try to. And we always, if it's not something we order, we always will recommend testing to ask your physicians to order for you. I will never feel satisfied unless I can help somebody figure out why they got SIBO in the first place. So we will absolutely use all the resources that we can to try to determine why you got SIBO in the first place and how we can prevent you from living with SIBO or having SIBO relapse.
yes.
All right.
Which one do you want to answer?
What is Motilin?
What is Motilin?
So, Motilin is a hormone that is produced in the small intestine, and it's activated by bile passing into the small intestine. We know that, like I said, your liver makes it, your gallbladder squeezes out bile, and it empties at least 35% every time you're eating to bring in bile into your small intestine. And then again, once that enters the small intestine, activates this hormone called motilin, and that's essential for motility. So if you say, I'm somebody with liver issues or gallbladder issues, you might be lacking motilin, and that could be maybe a root cause of your SIBO
Oh, sorry.
and just not having enough of that bile.
And how many of you have your gallbladders? So leave a comment if you want, if you have your gallbladder or you don't, right? Because we know at least 2.5 million people a year in the United States don't or are losing their gallbladder, and it's very sad. So this is an epidemic. Your gallbladder is important, and it plays a vital function for your gut health.
And there was a really good study that showed that a high percentage of people have SIBO show up within 2 years of having their gallbladder removed. So something to look out for if you're like, I have gallstones, I've had gallbladder sludge, or I've had just my gallbladder removed, you're at risk for SIBO.
And even before that, I have chronic high cholesterol and high triglycerides and
hormonal
imbalance. That is a sign you're putting extra stress on your liver, extra stress on your pancreas, extra stress on your gallbladder
and your gut.
And it's all domino effect for sure. I finished Flagyl and Xifaxan and felt better.
Then I went away and was very constipated, and I came back and I'm feeling like I'm in a SIBO relapse. Help. So if you were prescribed Xifaxan with Flagyl, you probably have methane IMO, and I'm wondering if you were put on a pro-motility agent during treatment, and if you stayed on something for motility after, and if you tried doing low FODMAP for 6 weeks after you were treated.
So really simple with that is it's great. You're given some of the medication and the antibiotic, and that can be very helpful if it's not paired with the proper lifestyle change, especially nutrition. That is the winning combination. If it's not, you will likely relapse because taking the antibiotic and great, you killed a lot of the gut bugs and you're like, wow, I feel better. Or you're taking a motility agent on top of that, I feel better. Once you get off, it's right back to where you started typically.
Yeah. And again, you want to support your root. So if you know motility issues were a root, maybe you had a C-section or you had abdominoplasty or you've had any type of hernia, abdominal hernias or endometriosis, and you've had any type of scar tissue or adhesions in the area around your abdomen, and that caused motility issues for you, that could be a root cause. Maybe you have diabetes and you've had a lot of gut enteropathy, which is really low activity of those nerves in the gut, and that's maybe your root cause. Or maybe you have some type of neurodegenerative condition like Parkinson's or
dementia.
Yeah, absolutely. So maybe you've had a type of traumatic brain injury,
Mhm.
or maybe you have hypothyroidism. It could be something like that where you just have hypothyroidism and your motility is slowed down. Or like we said, maybe you've had post-infectious gastroenteritis and that affected your gut lining. So you really want to figure out your root cause so that way it doesn't come back.
Okay, these are great questions, guys. You guys have a lot of
Mhm.
great questions. Do you want to answer
Yeah.
maybe or
Yeah.
okay? Should I switch up with 5-HTP? I don't like Linzess or Big Pharma. I do take magnesium citrate.
Ask your care team, definitely. I would say the only time you don't want to take 5-HTP is if you're on an antidepressant or anti-anxiety medication. It's not safe, or if you're pregnant. So ask your care team if 5-HTP could work for you, and they can help you figure out the right dose.
And I have to comment on the ultimate solution to big pharma is to be healthy. If you really want to stick it to big pharma, be healthy. And then you don't have to opt in to big pharma. I know it's easier said than done. There's so many things there, but ultimately, what I'm saying is take action for your health. The healthier you are, the healthier typically your kids will be and your family will be, and you are taking money away from big pharma.
Mhm.
Okay, as long as you follow all the rules, is SIBO curable?
For the most part, yes.
Yeah.
Yeah, SIBO can be very curable if you help eradicate it, keep it away, and support your root. For most people, yes. Although there are some people who will just chronically be at risk for SIBO relapse. So, for example, somebody who has issues with their ileocecal valve, maybe that little door between their small intestine and large intestine doesn't close. Maybe they've had a surgery there. Maybe they have a type of condition with their autonomic nervous system where it doesn't close properly. Maybe they have short bowel syndrome or something that's affecting their ileocecal valve from closing. That person might need perpetual support for SIBO.
Mhm.
There are other conditions in which somebody just needs perpetual ongoing SIBO support to keep their symptoms at bay. But in general, if you're not somebody with a significant issue like that that's going on, then your SIBO should be treatable and you can go on and live
And
a
we
happy life
and we
without
say
it.
curable, but really it's just finding that balance. Really at the deeper, I guess, root of this is really finding that balance and reconnecting with the things that are true in this life, which is reconnecting with truly healthy, unadulterated food and your family and loved ones spiritually, emotionally, so much. So yeah, and food and the environment. There's so much deeper here,
Mhm.
but it really is your body is just telling you, I'm imbalanced and I'm suffering. It's really just about finding that balance. Everyone's a little different in that. Um, oh yeah, is fiber bad for SIBO?
And look at part two.
And then part two, my doctor told me when you have slow motility, you can't ever have an abundance of food and low fiber diet. Find a new doctor. No, I'm just
Mm.
kidding. No, but look, guys, a vast majority, I think a study that was back in 2019 or even 2020 interviewed doctors and they did a review of this and they found that roughly 60 to 70% of GIs didn't believe nutrition played a role in the gut issues their patients were having. Thank you so much for watching this video. We know you're probably getting quite a bit from it. It can be a lot of information, it can be overwhelming, and we totally get that. Dahlia was there not too long ago suffering with IBS and SIBO-like symptoms. She was hunched over very often, bloating, gas, constipation, diarrhea, skin issues, hormonal issues, the list goes on and on. So we know this. We've been in practice now as registered dietitians for over a decade, and we created our Good Gut SIBO IBS program for you. If you're experiencing IBS, SIBO symptoms, IMO, SIFO, the list goes on and on. If you're like, I'm not really sure what this is, click down below. We have a free assessment for you, and that'll likely lead you to our Good Gut SIBO IBS program, which is chock full of information we wish we had. It's information that we're giving to our patients, so it's all at your fingertips in one package. It's 7+ hours of video. It is dozens and dozens of handouts. It's tailored meal plans and recipes to truly help you get to the root, to truly help you understand what's going on so you can truly heal with each meal. Check it out down below. That's insane. Okay, I'm just going to straight up say it, right? Because anyone who's up to date on the science, I mean, you're seeing otherwise, right? So this is supported by unbiased science that is going what you're eating definitely plays a role. Not, I would even go beyond that. Not just in your symptoms, but really the gut is the nexus of all health on the planet. So literally what you're eating affects all the health on the planet, and it's a ripple effect, right? So yeah, I mean, if your doctor is saying, hey, what you're eating has nothing to do with this, and if you have slow motility, just, don't do fiber and don't, I mean, that is kind of off the wall because it just doesn't align with any of the research whatsoever.
In certain conditions, inflammatory conditions, yes, you want maybe to temporarily reduce your
Yeah, here's
fiber.
the
So
context you need.
maybe if you have inflammatory bowel disease and you're in a
Right.
flare, Crohn's colitis, if you have diverticulitis and you're in a flare, your gut is extremely inflamed, maybe you don't want to be eating a ton of high insoluble fiber roughage. That's, again, just rough to break down. So, in that case, yeah, a low fiber, temporary low fiber diet can
Very
help
temporary.
until you calm the inflammation. But that's going to really keep you out of another flare. So, you don't want to perpetually eat a low fiber diet. That is in extremely rare cases warranted. But for SIBO, it's not necessarily not eating fiber, it's helping your motility, right? If you need some help with motility, you want to help that. And it's clearing the SIBO so that way you can eat more fiber, and you want to eat the fiber to feed your good gut bugs and to help with motility. So no, you should not avoid fiber and hope that that's going to clear your SIBO. Like James said, it's kind of that debt analogy where you're temporarily avoiding the discomfort of the symptoms, but you're not going to ever clear the root cause if you're just avoiding what's giving you symptoms.
And I would guarantee, I mean, based on the research and our experience, that really it's a low fiber diet that got so many people into these situations. It is a low fiber diet. The USDA data is very clear. 97% of us,
Mhm.
of Americans, are not even meeting the recommended fiber intake, and that is already pretty low.
Mhm.
So we are clearly already all on a low fiber diet that is causing massive amounts of inflammation. The It's very much a political response. Hey, the political system is broken and it needs fixing. Let's fix it with the political system. It's like, no, I mean, that's essentially what's going on here. Hey, a low fiber diet got us into this mess. Let's fix it with an even lower fiber diet. No. Again, context. If you're really in a bad place, you need to take some drastic measures. You may need medication. You may need big pharma's help, but it's to get you out of that situation. You don't want to stay there. You don't want to dig that hole deeper and then need
Mhm.
more and more pharma and less fiber and get yourself in a really, really bad place, which we see a lot of people doing. I mean, I'm seeing videos, guys, of people eating raw ground meat and raw fish because they no longer can handle certain forms of cooked foods or other foods, and they're just eating a raw meat diet because they're in such a bad place.
They're
Like
going to get parasites.
we are getting to that point, and they're not going to show you
No.
the side effects of that. They're not going to tell you they haven't pooped in a week. They're not going to tell you that they're getting severe stomach cramping. They're not going to tell you what their blood work is accurately. They're not going to say all these other things that are going on. They're just going to make it look amazing and show them lifting weights, right? So
Whew, that's rough.
a lot of, I know, a lot of stuff. But yeah, you can see this that's why we love this topic, guys. Gut health is the nexus of all health on this planet. Your inner ecosystem is the most important ecosystem. We are here to support that and support you.
We
And
want to keep
maybe
answering your
we'll keep
questions.
answering. Let's
Yes.
go.
Someone's asking, I'm seeing a GI, and I'm sure she will say, but can a probiotic make SIBO worse? In most cases, yes. You don't want to give a probiotic to somebody who has active SIBO. So
Mm.
if you're somebody who says, I take probiotics, or even sometimes I eat very probiotic or rich or fermented foods and I feel much worse, that could be because you have SIBO. So if you historically find, I have low tolerance to probiotics, I can't drink kombucha, I cannot eat fermented foods, you might have SIBO. And you might want to wait until you have clearance of that SIBO to introduce the probiotics. The analogy I like to give, it's like adding more fuel to an active fire. Sometimes that's not what you need. It's rarely what you need. There are certain cases in which I will recommend a specific type of probiotic, but it's very rare. So for the most part, no.
And in this time, I want to shout out our Good Gut members who make these lives possible. It's our
Yes.
Good Gut members who are patients who then become members who make these lives possible. They get dibs on the questions, and shout out to them, and also our future um, Good Gut SIBO IBS program members. They make these lives possible. So shout out to them. And if you're interested in any of that, click the links down below, sign up for our newsletter so you can be the first to know what we have going on. But let's keep, oh, great comment. I love you all for the information you both put out. All very useful for my mom who's had so many gastrointestinal problems.
We're happy to hear that.
Yeah, guys, this is our purpose. This is our yeah, our purpose in life, our ministry, so to speak, of like really trying to help people. Really, our tagline encompasses what we do: heal with each meal. We did it for ourselves. We see our
Mhm.
daughter thriving, and we're thriving, and so many of our patients. So we love this.
Thank you. How do we activate motilin with a supplement? There's no supplement really that can activate motilin, but there are certain foods you can eat and certain things that can help with bile output. So you really want to determine, is it from your liver? Is your liver struggling to deliver the bile to your gallbladder? Or is it your gallbladder struggling to squeeze the bile out? Or do you have a blockage in your small bile duct? So it's not getting from your gallbladder to your small intestine. First thing I like to start with is bitter foods. Just start eating more bitter foods. Bitter greens, if you tolerate them, like arugula and dandelion. You can eat bitter cruciferous vegetables like broccoli sprouts or cruciferous. You can eat some of those roots like rutabaga and radish and parsnip and
Cilantro
turnips,
and basil and yeah,
ginger,
parsley and ginger.
turmeric,
I mean, there's so many.
coffee, green tea, apple
Basically,
cider vinegar.
anything that most American kids go, "Oh, I don't want to eat that because it's bitter and it has that pungent taste and it's very aromatic." Those are the healing
And that
foods.
stimulates your bile to or your gallbladder rather to squeeze out some bile. So start with the bitters. Sometimes you might need additional support. Other things have been shown to be helpful, like trifala, which is a bitter root. It can help with stimulating bile production. There are things like phosphatidylcholine, which can help to bind the bile to bile acids and kind of improve its flow. Sometimes different emulsifiers like lecithin can be helpful. There's a different combination of different things. So if you're curious, ask your care team. But first, start with those foods. Eat artichokes, eat some of those bitter foods, and see how that goes.
Biocidin, what are
Your
your
thoughts.
thoughts? I mean, I love biocidin. It saved my life.
James has gotten gastroenteritis 3 times in a row now when we're on vacation from
Oh,
surfing and snorkeling.
guys, there's something with snorkeling. My stomach gets messed up every time I snorkel. I
Or
don't know
surf.
why. So anyway, that's my own. I got to do some research on that and figure that. Other than that, I have no gut issues.
Yeah,
Although
it's
that might be the
interesting.
one thing. I grew up in the '90s. I wasn't breastfed. Constant antibiotics, Pop Tarts, and sugar was my essential meals all the time. And so this is that's my thing is I can't snorkel now because of that. Who knows? I don't know.
But anyways,
But
back to
anyway,
biocidin. So we use biocidin. I always keep it on hand in our home in case of gastroenteritis. I recommend it to some patients, but again, it's not a one size fits all for SIBO. So some SIBO types will respond to biocidin, while others will get worse. It does contain neem and it contains garlic, so it is sulfur based. And somebody with hydrogen sulfide SIBO would not do well with biocidin. I also don't usually use it for methane IMO, so it just depends on your SIBO type. And if you tolerate it, you could try it for somebody with fungal overgrowth or hydrogen overgrowth respond well to biocidin. So we'll use biocidin. We use a combination of other different things, or we'll recommend them.
can IBGAR, you want to answer that?
Mhm.
Can IBGARD make you go too much or cause colon to cramp?
Yeah. So IB Guard, it's a combination of different ingredients, but I want to say their active ingredient is peppermint. So
Yeah,
yeah,
it's
it's
peppermint oil.
peppermint. And that's really the main active ingredient that it
Mhm,
contains. But it might just be too much lower GI motility.
mhm.
Ginger is helpful for upper GI motility, while peppermint is helpful for lower GI motility. So if you're finding that it's causing lower abdominal cramping, it might just be too much peppermint for you. Also, I don't love IB for the fact that it has a lot of other additives in it. It has polysorbate 80, it has FDNC yellow, it has glycerol
Not a
monosterate.
very
So,
consciously thought out
yeah,
supplement.
it's not my favorite one. If you're going to try a peppermint supplement, I like Atrantil. And Atrantil is peppermint with a couple other antioxidants in it, and it doesn't have all these additives. So, I personally I don't recommend IB Guard to anybody. If I'm going to recommend peppermint, it's going to be strong peppermint tea or Atrantil. But yeah, you might want to try something for upper GI motility if lower GI motility is irritating to support for you.
Should we stop here?
We can answer a
Keep
couple
going?
more.
Okay, we're gonna keep going.
These are great
Dolly will go
questions.
for the whole day, but I think we're gonna get cut off at about an hour. But okay, what if it was food poisoning? How do you address? Can there be permanent
Mm.
damage now?
Yes, absolutely.
Yes.
So, studies do actually show that
With
10 to 15% of those with post infectious gastroenteritis
food
will
poisoning.
have long term IBSD. Um, and IBS. So,
Mhm.
absolutely, that could be the root cause. There's actually a test to test for that, which is pretty cool. It's called the IBS Smart Test. It's a blood test which can test for antibodies to these little toxins that sometimes these uh, foodborne illnesses will leave in your gut. And it can test for antibodies against something in your gut called vinculin, which is the protein that
Mm.
literally plugs in the little villi in your intestines that help with motility. So, if you're wondering if post infectious gastroenteritis is your root cause, you can ask your provider if they can order you an IBS Smart. And I have seen that with a lot of my patients.
Mhm.
What are your thoughts on Purium? I would say they make great quality products. They're not always appropriate for those with SIBO, so I think it just depends on what's in them. But they have some good options like protein and a couple other things. Like their tart cherry juice is great to help with sleep. So I think it just depends on what you're using.
Yeah.
I will say if you have SIBO or IBS, sometimes more is less, unless it's something that's very targeted for your gut. So if they're just kind of other supplements, you might want to be cautious with them.
And and I think, yeah, I think overall, I mean, they have good quality supplements, like, you could use their supplements, but again, if you're like if you have IBS or SIBO and you're going like, "Okay, it's all due to glyphosate," and I think Purium's gonna help just get rid of all the glyphosate in my body, or if that's what you're kind of hearing, not that they're actually claiming that, and that's the root cause, that's definitely like, we are totally aware of pesticide residues on foods and that being a huge piece of the puzzle, but that's not the entire root cause. That is maybe one tiny little root from our experience. So,
I'll answer a couple more because, like James said, we're going to get cut off.
yeah,
How to keep your IC valve closed. So, your ileocecal valve, again, the little door between your small and large intestine, work on your nervous system. That is one of the biggest things that I see keeping someone's ileocecal valve open. And make sure you don't have any type of scar tissue, adhesion, anything pulling on it. I have a patient right now. She has all the SIBO symptoms. We're in process of getting her tested, but she has a huge ovarian cyst and it's putting a lot of pressure there on her IC valve and it's keeping it open. So you want to rule out anything like that pushing on your IC valve, any scar tissue or adhesions pulling it open, or your nervous system. And usually with dysautonomia or somebody with POTS or some type of disease of the autonomic nervous system or disorder, their nervous system is in a hypervigilant state and that keeps it open. So start there, work on your nervous system.
in case we get cut off on IG, join us next month for another Good Gut Live.
Yes.
Follow, turn on notifications, like and comment down below, and we will see you for registered dietitian talk and our Good Gut Live that we do monthly. So 2 lives a month. And sign up for a newsletter, marytalk.com, all that good stuff. I think we'll continue another live if you guys enjoyed this. Again, we love all the support. We love the love. Thank you to our patients in our practice and Good Gut members for bringing these lives
And
to you.
I am I see SIBO patients throughout the world. We have another dietitian, Rachel, as well. We are both licensed in many states. So if you're curious if you can work with us, you can always inquire. You can register at marythealth.com and we can let you know if we can support you. But absolutely.
It's crazy to think we're one of the largest integrative registered dietitian practices, especially with plant-based registered dietitians. So we have 7 total dietitians, all with different specialties. So
We're definitely going to save this live for
Yeah.
those who are asking. It's not cutting us off
Yes.
yet, so let's try to get in just a
Let's
couple more.
keep going.
Somebody is saying, if I have celiac, will I have SIBO forever?
Ooh.
No, but maybe you need to support the damage that was done to your small intestine before you knew you had celiac. Maybe you need digestive enzymes because, again, you make
Mhm.
a large percentage of digestive enzymes in that brush border of your small intestine. So maybe you need to replete digestive enzymes, and maybe you need to work on leaky gut support. And hopefully that will help with clearing your SIBO. So hopefully not. If you have SIBO, if you have celiac, you shouldn't be living with SIBO for the rest of your life.
Mhm.
Mhm.
That one.
But
Please
yeah.
discuss incomplete bowel movements and being uncomfortable
Ooh.
and gassy all day because of it.
Oof.
Yes. We talked about motility, we talked about constipation. Again, incomplete bowel movements is constipation, right? So you are still constipated. If you're not feeling satisfied and completely evacuated, you are constipated, right? And
Mhm.
that means your motility is off, that means you have dysbiosis. It could be other underlying root causes. So you want to work with someone knowledgeable. If you want to find out more, go to marriedhealth.com and connect with one of our dietitians, and we can help.
How do you know if you have SIBO? We talked about at the beginning. Get breath tested. So you definitely want to try.
Repeat past the question.
If I live in SC or NY, are you allowed to treat in other states? Yes, we can
Yes.
see people in New York for sure.
Apple cider vinegar before meals, good for SIBO. Overall, yes.
Hmm. Overall, yes.
Overall, there's some
Most
nuance,
people,
but
yes.
most people. Vagus
Absolutely.
nerve,
It
I
was over a
was.
year ago, food poisoning.
Hmm.
If I do an IBS Smart and I have antivinculin, is it curable? You really, really, really want to work on leaky gut support in that case and work on motility. So if you've done an IBS Smart test, you
Mm.
know that you have post-infectious gastroenteritis. You really, really need to support those two things because you are less likely to have MMC cycles, which is your migrating motor complex that helps to activate your motility in your intestines. So you really need to support that. You absolutely should be fasting 3 to 5 hours between your meals. You should not be someone who's grazing all day long. You want to find out the best way for you to be eating. And then you definitely want to work on your gut barrier and your motility. So,
Does
absolutely.
SIBO bad bacteria literally crave sugar and carbs so it can survive and multiply? Overall, yeah. There's some good there's some good info on that and data where essentially microbes are sending signals to your brain where microbes an overabundance of certain kind of microbes can contribute to cravings.
They can, yeah, for sure. They can absolutely guide your cravings and make you want to eat more FODMAPs or make you want to eat more sulfur or make you want to eat um,
Mm,
more yeast. And I was mentioning earlier, I don't believe in the Candida protocol. So I'll
mm.
either use low histamine or sometimes I'll just
Shots
say,
fired.
don't eat more yeast. Like, don't eat mushrooms, which are in the yeast fungus family. Don't eat nutritional yeast. Don't have yeast in bread. Don't eat yeast extract and spices. Just don't add more yeast. And then hopefully that will help
Which is essentially
as you're
really
getting
helpful
treated.
because you become more mindful and you're essentially not eating hyper processed foods where yeast is hiding. So it's a win-win across the board.
Yeah.
I got a Truvaga vagus nerve stimulator, which is
Mm.
helpful but
Ooh.
still hard with scar tissue.
Mhm.
Yes,
So that can be
very cool.
hard where you know you have scar tissue that would require ongoing support, hopefully from somebody who is knowledgeable in something like myofascial release or visceral manipulation therapy, and they can help loosen up that scar tissue as often as possible. But I
Guys,
love that vagus nerve
think of
stimulator.
we are bioelectrical beings and think of our skin as solar panels. Like when you are getting scars and scar tissues internally, externally, and all the nerves in our body, all the nerves in your gut, we are bioelectrical beings and we can impede those impulses and cause a lot of issues. So this goes way deeper. This is all, even everything Dahlia said. If you made it this far in the live, we love you. Like this is a really long
And thank
live.
you
We
all for
usually
your
go long,
support.
and
Thank you,
thank you all for
Trish.
the support. If you made it this far and watching this, then this is still just scratching the surface. But it's very, very important to begin this journey, and
Mhm.
we meet you where you are for sure.
Yeah. How do we test for POTS or dysautonomia? A
Mm.
tilt table test with a cardiologist is the best way to know if you have POTS or dysautonomia, which can be a root cause for SIBO. So these were all
Someone said,
amazing
I'm late. I love
questions.
you too.
Thank
Nice.
you. Sending you love.
Well, real quick, you can rewatch this on our
Yes.
IG. You can rewatch on YouTube, Facebook. We restreamed this and it's saved on our social media platforms. So go back and take notes because there were gems for sure.
Thank you to those who participated, asked great questions. We hope you all gleaned some information. It sounds like a lot of you are struggling with SIBO, dysbiosis, IBS, post infectious gastroenteritis, so many things, and there are solutions for you. So if you haven't found them yet, keep searching for the right provider who can help just educate you, help you feel empowered so you can advocate for yourself and help you get more answers because nobody should be living in daily pain. And I say that as somebody who has had a history of having IBS, who lived for
Mhm.
years in constant discomfort with IBS and is now on the other side of that. And I'm so empowered to help other people not live that way.
Right. All right, everybody. Have a wonderful weekend. We'll talk soon. Again, see you on the next Good Gut Live or Dietitian Talk. All
And we
right.
hope you continue to heal with each meal.